This is Mark L. White for another episode of Health Hacks. And today I'm happy to welcome Dr. Carl Walker back on our show. And as you guys might recall, we spoke about ED last time. It's great seeing you. You're up in Idaho now, right?
I am North Idaho, Coeur d'Alene area.
Nice, nice. You got situated. I know last time you were in the process of moving up.
Right, right. So all situated. Took the boat out on the maiden voyage yesterday. It was a beautiful day. Nice cruise around the area. So yeah, it was fun.
That's
Doing
awesome.
off there.
Last time you were on the show, we were talking about ED in general. And I know that being a urologist, there's a much bigger picture to men's health.
Yes.
So tell me about it.
Yeah, I think what I mentioned last time is that when a gentleman comes into the office and we kind of look specifically at an organ system, it's like, okay, you have erectile dysfunction. We think about, okay, well that's a blood flow issue. And the thing that I try to emphasize to the patient is that what's happening below the belt originated above the belt, and so we can give specific treatments, but eventually those may not work as well, or they may fail altogether, and we need to kind of keep upping the treatment protocol to get the desired result. Whereas if we kind of maybe take a step back, take a look at the 10,000-foot view, how did you get here? What are the things that you can do to improve blood flow throughout the body? And that will not only improve, erectile function, it'll improve your cardiac health, your exercise tolerance, your sense of well-being, and where are you on that spectrum? How far back do we have to go to get back to better health, so that things, at least even if they don't reverse, at least they stabilize or at least improve to a point where now that patient is motivated to start making some good healthy choices.
Ideally, if it's a blood flow issue, ideally we want to find out what causes the blood flow issue. What is it usually? Diet, exercise?
Yeah, it's a number of things. I mean, I think there are things that we have looked at over the past 40, 50 years, and we started to focus on, what's causing the health issue. Is it a heart blockage issue? Is it a cholesterol issue? Is it a blood pressure issue? And I think, obviously all of those are factors, but I think the concern is that, we've been studying heart disease intensely, knowing that it's the number one killer, um, and we haven't really made a lot of headway. It's still the number one killer. And so, um, I think we're scratching the surface, and maybe we're looking at things in a wrong way, because I think everybody's a little bit individual. And so everyone has to take a little bit of ownership for what is it that makes, when I was in my best health, my best weight, what was I doing different than I'm doing now? And because, for some people, it's a diet, like a, fasting will work. For some people, it's calorie counting. For some people, it's going to be whole foods, or, some special diet, or something that they're going to do, but it's not going to work for everybody. And so you kind of have to, peel off some layers and say, okay, what works for me the best? But I think just kind of common sense things is that, if you're eating good, healthy, whole food, and your sugar levels aren't too high, then we're definitely heading in the right direction. I think the buzzword is that not everybody has diabetes, even though it is, very prevalent disease. A lot of people have insulin resistance, and that's kind of the starting point for what we call metabolic syndrome and pre-diabetes and ultimately diabetes. And once you have that, or once you have that diagnosis, you tend to be grouped into a category where you're you have you're more prone to a lot of other diseases, hypertension, heart disease, atherosclerosis. So, insulin resistance tends to be a big actor in that, and and so I think that's, a lot of that has to do with, what are we eating.
So when guys are coming to see you, is it usually the first thing that they're noticing is ED, or is there something else that's even before ED where we can catch it even earlier with metabolic syndrome?
Yeah, so it can be fairly subtle. I think the reason guys will come in is because of the ED issue. They may not come in for other things, but they will notice when you start to talk to them. It's like, yeah, I feel a little bit sluggish. I don't have good energy. I fall asleep after dinner. Or they may notice physical things like my pants used to fit me. Now I'm having to go to the store and get extra couple sizes larger, and my belly's hanging over my belt and it's kind of uncomfortable. So, they'll tend to notice some physical things once you start questioning them. It's like, as a routine, we have guys come in, we check a height, weight, and a blood pressure. And so once you've, mark those things down, those are very objective findings. They'll go, oh, my weight is up 20 pounds, or, um, you know, my, um, my blood pressure is elevated and I never really check it at home. So then you have some factors, some objective factors that you can work with and saying, well, ideally, if your blood pressure was, under control and your weight was down 20 pounds, then, we've made some objective findings that are pointing to poor health, future poor health outcomes.
Is there a simple way to test for blood flow?
For test for blood flow, yeah, good question. Are you talking about blood flow through to the penis or blood flow through the whole body?
Through the whole body, because if the ED is the canary in the coal mine and there might be cardiac problems, maybe the guy has a higher risk for heart attack, is there a way he can test to see how well his blood's flowing through the body?
So they have, there's different. Probably the most accurate would be something fairly invasive called an arteriogram, where you start an IV and then you inject contrast and you take a lot of X-rays that show blood flow through the body. We're typically looking, you know, at a specific part of the body based on a complaint. Like, if someone has, leg pain or evidence of low blood flow to the um, to the extremities, we might do an aortogram, or, where we look at the iliac vessels. But those are usually very late in the game type of studies. If someone clearly has signs of poor blood flow, like a cold extremity, we definitely don't want to get to that get to that point. So, the if you get a cat like a full body CAT scan, it can show calcifications. Um, they have special CT scans for the heart that will show accurately calcifications in the coronary vessels, which can definitely be a sign of poor blood flow to the heart. But for the whole body, we don't really have that, and I'm not sure if we use that, like, again, in really severe disease states, like someone comes in with a cold, foot, or they have signs of some gangrene, some really late stages of people that have really bad diabetes or really bad peripheral vascular disease, like heavy smokers. So I think that, backtracking to the guy that shows up to the office and say he has ED or just doesn't feel well, um, we may be we may be well past the point of helping that person if we wait to look for blood flow. So I think what we, one of the things that's been really kind of, I would say, game changing is looking at heart rate variability. Um, there's some really cool tools out there. I don't have one, but I want to get one. It's called an Aura ring. It's basically just it looks like a regular ring.
Like
You have
this?
one? Oh, very cool. All right. Well, you can school me on why you got it and what it's doing for you.
Yeah, I got it about a year and a half ago, and I originally got it for sleep.
Okay.
It tells you how well you sleep, but it does tell you your heart rate variability. Um, Mine's optimal,
Great.
and it talks about how, like, during when you sleep, showing that your heart rate doesn't change too much during sleep. That if your heart rate is changing a lot, that's an issue. Um, Going back monthly, it gives you a score, and it's funny because it's seems to be all over the place. I don't know. It ranges anywhere from 14 to 20.
Okay. Okay. Yeah.
But I don't know. Like, it's funny because I use it to tell my sleep score. So I wake up, I'm like, oh, I slept well, and usually I know if I sleep well, but I use this. Oh, I got a 75. I got an 85.
Great.
And I've never really paid attention to heart rate variability, but now that you mention it, what should I be looking for and why does it change?
Yeah. So there, obviously in the body we have the sympathetic and the parasympathetic autonomic nervous system. And just to simplify it, the sympathetic system is the fight or flight. So if you're fishing in the woods and then a bear, you know, you see a bear and it sees you first and it starts chasing you, you got to get moving to outrun the bear if you can. So that's a fight or flight response, and that's your sympathetic.
Or I hand them my fish.
Exactly, exactly. And whereas the parasympathetic is known as the feed or breed response. So it's kind of a state of rest and relaxation, and it needs to be in balance because you need both sides of that sympathetic and parasympathetic working well at all times. The problem is things that inadvertently increase your sympathetic system kind of goes undiagnosed or uncharacterized because we don't really feel it unless we're really in tune with our bodies. We know that when we're on, vacation, a beach in Maui, we're at rest and we're having a nice drink and watching the waves, and we're relaxing. When you're sitting at your desk at work, you may feel like I'm relaxed, but you may be significantly stressed. And so your sympathetic heart rate or your sympathetic tone may be up, your blood pressure may be up, your heart rate may be up. You don't necessarily know that unless you're checking it. Some people, not just men, but men and women, but we're talking about men's health right now, is that they're in a chronic state of sympathetic outflow where that plays a very consistent and chronic role on their blood pressure and their heart rate, and it affects their overall health and their blood flow ultimately, because when you're getting a lot of elevated blood pressure, that causes the blood vessels to be stiff throughout the body. They don't have as much elasticity, and so blood flow throughout the body is going to be diminished. So if you kind of think about it, if you don't have that variability where, okay, I can recognize my stress and I can do things to decrease my stress. If you're in a very high pressure job, if you're a telephone lineman, if you're, a defense attorney, you're basically, you're going to be a chronically stressed person just based on your position. Policemen, firemen, a lot of people have stressful jobs. If they can't get, to a point where it's like, I recognize when I'm stressed, when I'm not stressed, they can't do anything about it. And that ultimately will have an effect on their heart rate variability. You want to be able to recognize it, do some deep breathing, do some meditation, do some prayer, whatever you need to do to get that the parasympathetic tone elevated, so that that basically lowers your blood pressure, lowers your heart rate, and allows you to deep or unplug at the end of the day, so that you actually get that REM sleep that you really need. There's light sleep, there's heavy sleep, there's REM sleep, there's different stages of sleep. Your body is a machine that needs to recharge, and it doesn't really get that good recharge unless you get a good several hours of good deep sleep every night.
But you think about these guys, they're assertive drivers.
Yeah,
They're the guys that wanted to do well in college. They're strivers, but they're wired a certain way. They're wired. They're very competitive. They're very controlling. And like just going to them and saying, "Hey, you have to be a Buddhist monk if you want to live long."
right.
I don't know if it sits well with them because it's like, and then they come to see you. I assume these are the guys coming to see you at 40 and 50 that are feeling burnt out.
Yeah.
But how do you capture these guys when they're 20 and 30 and they're winning and they're competing and they're striving and driving?
Well, it's again, it's not a problem till it's a problem, and guys tend to be, if it's not broke, I'm not going to fix it. But I think ultimately, at some point, you realize that if you're a super competitive person, uh, you get to a point where even if you're winning, you don't get that level of satisfaction. So you have to kind of have some self introspection and say, wow, what am I, what am I doing? No one ever won the rat race, and it, um, at some point you feel a sense of like, okay, I'm not getting satisfaction. I feel really fatigued, and I feel, really unsatisfied with even with my high level of accomplishment. Um, we utilize, in the first line therapy, or the um, you know some of the questionnaires that we use special questionnaires that identify stress. And once you kind of objectively mark the score and say, okay, yeah, I'm under stress, then we have something to work with. And sometimes it can be something very easy. It's like, you don't have to necessarily change your job and move to the country, but you can take 10, 15 minutes at lunchtime and do some breathing techniques. Or on the weekend, as opposed to your normal routine, you can go for a hike, a few minutes from your home. Um, Pets are great. Having a pet that you enjoy, um, releases oxytocin, and is a, kind of battles the high cortisol levels in the body. Just having good social relationships, having good relationships with your spouse and your kids, or a social group that you get together with, but make that a routine so that you can actually get that de-stress time that you need so badly.
How about looking at, you mentioned oxytocin, you mentioned cortisol. These are hormones. Obviously, there's testosterone. How important is it for a man to look at all of those hormones, and are there ways to regulate cortisol or supplement with oxytocin to help achieve better health?
Sure. Yeah, without making it too complicated, I think a good standard blood test is key. That's going to check for, lipid panel. Obviously, we won't get into a big conversation about cholesterol, but, that's always been kind of the thought, oh, if you have a bad cholesterol, you're at risk. And I think, we can probably, if you're relatively normal range, or maybe just a little above normal range, it's probably not as big an issue as what we were just talking about with the heart rate variability and the stress levels. I think that's going to be a bigger factor on chronic issues with your ability to sustain good health. And cholesterol is kind of the precursor for in the body hormones like the testosterone level. So checking lipid panel, checking a testosterone level, checking a cortisol. Um, Cortisol is a little tough just because you can check it at, unless you have a disease process like an adrenal disease process, you're typically not going to have such high cortisol levels that a random blood test is going to catch it and say, oh, you have high cortisol levels and we really need to treat this. We need to do something about it. That's not typically the case. That's where, just kind of a self-identification or questionnaire that identifies men that are at higher stress levels, really, I think is more beneficial. And things like the Aura Ring or a lot of other devices that are there to kind of measure your, again, we talked about heart rate variability, we talked about sleep. So, good sleep hygiene is very important. I mean, once you've ruled out, like, okay, someone has a really low testosterone level, and that's typically going to cause, fatigue, decreased libido, definitely can cause ED issues, and that can be replaced. There's several ways to replace that. That being said, there's a lot of guys out there with normal testosterone levels that still have, otherwise poor health. They have, high blood pressure, elevated heart rate, maybe cardiac arrhythmia, some heart failure issues. So when guys start to get into the 50, 60 range, that's when we typically see the end result of several years of insulin resistance and elevated blood pressure and heart rate.
Are there any lab markers that every guy over 50 must know about himself and track on an annual basis?
So I believe that when you go in into and you get your routine physical, there are certain blood tests that they're just going to be routine. You're going to get these once a year. Most times your family practice doctor is going to check a complete blood count. They're going to check a lipid panel. They're going to check your electrolytes, and they're going to check, probably a liver function panel. Hopefully they'll check a PSA level. That's kind of my wheelhouse, prostate specific antigen. I want to make sure I'm not missing prostate cancer in a patient who maybe has never had a PSA level checked or may have a family history that's significant. And so those will be the main ones that are checked. Hopefully a testosterone panel, will be checked, looking at a total and free testosterone and possibly an estradiol level. I think those will be very important to check for, a adult male at age 50 who maybe doesn't typically go to the doctor.
How about the role of like inflammation, things like C-reactive protein, homocysteine? Do you look at any of those to see if they have high inflammation levels?
I check them, with my patient population. I always check those. I'm always looking. I like the CRP, the high sensitivity CRP. I think it's a very good marker for overall, body inflammation. A lot of times it'll go hand in hand with, homocysteine level. For those guys that have inflammation, the key would be to try to identify the inflammatory, factors. Um, a lot of times, if you can look at the gentleman and you can look at their, look at their weight, look at their waist circumference. Waist circumference is kind of a really good general tool, and you can kind of ask them questions. How much weight have you gained in the past year? Have you gone on a diet, or have you tried to lose weight? And what was your success with that? And sometimes it'll be a testosterone issue. If they're, you want to have a good testosterone to estrogen ratio. If they're highly estrogenized, then it's harder to lose weight despite them going to the gym regularly. But when you ask them, what is your habit, what's your day like, and they have a desk job and they don't have time to get out and even go for a walk at lunchtime or on the weekends, then you really want to try to help them get into a place where they can get, a regular exercise routine. And specifically, you want to look at, what's your diet like? What are you eating? Because that's going to play a big role on inflammation. Probably the number one reason for inflammatory issues is going to be diet related. Whether they may have a diet sensitivity or allergy, like gluten or dairy, or they're just eating bad food. They're eating foods that have a high glycemic index. They're eating a lot of simple carbs, and they're just inflamed.
So I guess the recommendation for guys over 50 is less sugar, less grain, more exercise.
Correct. Yeah. If you have to pick a diet, I would say the Mediterranean diet is probably the easiest to stick to. You can have a lot of good foods. You shouldn't feel hungry, and you're eating with uh, whole foods. You're not having to go vegetarian or carnivore. So you get a good healthy mix of vegetables and good oils and nuts and seeds, and good quality good quality meats. So you want to go high quality. You don't have to eat a lot, but you'll pay a little bit more for the grass fed and the free range things that haven't been injected with hormones and growth growth factors that kind of can interact with your body's hormone balance system.
How much exercise do you recommend to your patients after 50?
So ideally they're doing exercise ideally 5 times a week. And if they can get 6 or 7, that's great, but that's a little bit tough to do in the real world. But I recommend a mix of, a lot of studies have shown that there's a benefit to doing not just cardio, but doing weight training as well. So if they can do some resistance exercises, either with free weights, or they have some cool resistant band type machines. I saw one advertised, one's been out for about a year, called Tonal, Tonal. Or if you just have you want to work your big muscle groups, like your biceps, your quads, you want to do some things to that'll help one build your testosterone level by doing weight resistance, some heavy muscle work. And then if you can do that 2 times a week, 2 to 3 times a week, and then you can also do some cardio, either you can do treadmill or cycling, um, and high intensity interval training is really good. So if you have limited time, if you can do 30 to 45 minutes 2 to 3 times a week of hit type training, that'd be great. If you're not into gyms or having equipment at home, just getting out and doing like a vigorous hike, in your area for a good 30, 45 minutes would be great to do 2 to 3 times a week. Just get out in nature. That's going to decrease your cortisol levels. It's going to improve your cardiac tone, your blood pressure. But 5 times a week would be great. I don't think you need to do. I think a lot of, if you really enjoy doing marathons and triathlons, that's great. But I think that actually probably has a secondary inflammatory response on the body, because there's a lot of wear and tear. It's a little bit what we call catabolic. It breaks down muscle tissue that you need to rebuild. And there's some studies that show that really heavy duty endurance exercising actually causes some scar tissue in the heart muscle. So if you enjoy it, I think there's definitely, if it's social, you do it in a group, there's definitely some benefits there. But I think long term, I think doing shorter bursts of muscle confusion, high intensity interval training, as well as some resistant muscle training is very good for the body at middle age and advanced age. A great sign of longevity is muscle mass. So if you're doing things that break down your muscle tissue, you look kind of wasted away, because you're running 100 miles endurance race. It's probably not the best for your body.
And you mentioned a lot about stress, and a lot of buzzwords now are meditation, being present, focus. Have you seen a lot of guys benefit from adding a meditation practice into their lifestyle?
Definitely. I think that it helps you calm your breathing, and it definitely focuses you away from the the stress that you may not recognize that you're under. It basically takes you to a place outside of your work regimen or other things that unwittingly are causing your cortisol levels to go up and your heart rate to go up. And the monitors like that Aura Ring and other tools can definitely help you recognize that. But breathing technique, meditation works a lot on breathing. Just praying. As a believer, I pray, and so I get to a place where it's like, okay, it's not all me trying to make all this happen. But whatever you can do to defocus on things that you're going to tell yourself, oh, I'm not stressed. But in reality, you don't know if you're stressed or not, because we tend to compartmentalize it. We tend to kind of put it in a box and say, I just got to push through the day and get through it. Whereas, you don't know what you don't know. So I think it's, we've tried to hit the mark with, like I mentioned, oh, it's all about cholesterol. It's all about, blockage of the heart, the heart vessels. Well, we've been working on that for years, and we haven't really made a big dent in curing or significantly improving heart disease as being the number 1 killer for men. And so I think we need to kind of look at this a different way, or we're not going to see any headway. And that's important, because even if you don't die of a heart attack, if you have significant heart disease, it's going to affect your quality of life as you age. And you're not going to be able to do any of these fun things that you had planned on doing in retirement, or even your later working years.
If you do everything we talked about, the meditation, eating healthy, exercising, understanding your hormone levels, have you actually seen erectile dysfunction go away without the need for treatments? Do you see better sex life in older men?
Definitely. Yeah, I definitely have seen that. Now, I don't want to give a blanket statement saying if you do all these things, your ED will go away, because it's like anything, it's on a spectrum. How far down the spectrum are you in regards to your disease process? But I've definitely seen, a couple of things. One, when you lose weight, you're eating healthy, you're exercising, your libido goes up, so your desire to perform is improved. Now, desire doesn't necessarily equal result, because that's the bottom line. Are we getting results with, with our ability to perform sexually? You definitely can see that with those measures that we talked about. But I think the good, the definite thing, and when I tell my patients, because I don't want them to have unreal expectations, is that, hey, doc, I did all these things and you told me I wouldn't need the Viagra anymore, or I wouldn't need to do the Trimix, or the shockwave therapy, wouldn't be necessary. So what tends to happen is, like, let's say you are a gentleman and you're taking Viagra for the past several years. A lot of guys will realize that, well, I was taking 25, then I was taking 50, then I was taking 100, and then even the 100 wasn't working so well for me. When you start doing those healthy lifestyle changes consistently, what you find is that, oh, I can lower the dose, and or that dose works really well for me every time I take it now, so I don't have to worry about it not working. The other thing that I'll use some natural supplements that can, like I'm a big proponent of nitric oxide boosters. So L-arginine is an essential amino acid that helps release nitric oxide, which is it's a vasodilator, so it helps dilate blood vessels throughout the body, but specifically the erectile or penile tissue has a lot of nitric oxide receptors. And so when I say, hey, you're having some issues, let's put you on something natural. Maybe you don't need a prescription medication for your ED. We'll put you on L-arginine, we'll bump the dose up. You need to take a pretty healthy dose of it, but it's a natural supplement. It's not a pill. It's not a medicine. It's a supplement. And I've seen a lot of guys have a lot of good success with L-arginine, as well as adopting lifestyle changes.
So I guess the net result is the earlier you can make these changes, the healthier you'll be. How do you reach younger men who are in their 30s who haven't gotten there yet?
Right, right. Well, that's a great question. I think that's it's always a tough issue, because when you're in your 20s and 30s, you're on top of the world. You feel great. Nothing hurts you. And so I think it really comes down to how do we get our believable education on our health. Some young men are very self-motivated, and they're going to start right off the bat. They played sports in high school and college. I think if you look at like all of the high school and the college athletic programs, they've really put a big emphasis on nutrition and kind of doing things better than they did a few decades ago. And so I think there's been an improvement there. So I think they're getting some of that education. I think for if you're not in that grouping, I think the health classes that we took in high school, I think that needs to be altered and improved, so that our teens have a much better idea of, like, yeah, you can't drink Mountain Dew and eat Cheetos all day just because you're a teenager, and know that there's not going to be an effect on your body. And when you're still doing the same things in your 20s and 30s, that's going to have an effect on you. So I think that we have an opportunity in the junior high school, health class system, where, when I was going through, secondary, education, it was, a semester. It was a very minimal part of the education process. And I would say that needs to be improved. I think that's where we kind of get our basis. That, as well as hopefully as parents and grandparents, the men that I'm seeing as patients, they're going to pass on that knowledge to their kids and their grandkids, so that if they see them adopting unhealthy lifestyle, saying, hey, this is going to catch up with you. It would be a great decision to start making some healthy choices now, as opposed to trying to play catch up when you're my age. So,
Agreed. I really appreciate the time. What's next, or what else are you passionate about now?
so I think that the I think the pandemic has created a lot of changes of how we typically do things. I think uh, we've seen a lot more telemedicine. I think people are going to be consuming their health information, similar to what we're doing now with this podcast. And so I think the onus is to really kind of get good information to our our, our colleagues and our customers, our clients. Um, and I think that because we're going to lose some of that, as a physician, I'm used to seeing patients kind of hands-on, face-to-face. We have kind of this interaction. And I think to some degree, we're going to lose that moving forward, because I think, telemedicine and telehealth is here to stay. That's not going to go away. So it's going to become a big portion of what we do every day. And so we really need to kind of strive for excellence in how we improve that, so people are getting kind of that hands-on experience without being hands-on, and making it more interactive. So, similar to kind of the question answer format that we have here, but also the tools like the Aura Ring, some of the self-empowerment tools like, the ring, the exercise experiences that we're seeing, like I mentioned the tonal, the wall, the mirror. They have some of these. I'm not endorsing these specific equipment makers, but I think that when you can, if you can't get out to a gym, if you don't, it doesn't work in your lifestyle to do that. There's a lot of other tools out there where you can get that 5 day a week to 7 day a week exercise regimen in. You can look at your sleep pattern, your heart rate variability, so you can kind of take some ownership and see some objective improvement in your health just by things that you did, without having to go and sit in a doctor's office or go to a personal trainer. Try to make it, a telehealth type of process, but a self-empowering experience where you've done your research, you've gotten the tools that work for you, and you can really see some measurable difference.
I appreciate that. I think we have a lot of takeaways there, and I agree with you. I think as we get more of these devices that tell us what's going on inside of our body, and we have our phones and our wearables, I think people will be aware, and that's going to help us all. So thank you so much, Dr. Walker. I appreciate your time.
You're welcome. Thanks for
And
having me.
enjoy Idaho. Enjoy your summer.
All right, I
Take care.
will. Take care.